dear colleagues and guests. I'm very happy to see all of you at this gathering. My name is Gershkovich. I'm a music and vocal therapist, psychotherapist, and vocal teacher from Israel. The topic of my presentation today is the influence of music therapy for young adults with Down syndrome related insomnia. I'll tell you the story of one of the patients, Daniel, 28 years old, young adult with Down syndrome, and I'll share the process of working with him and the results. I would like to share some information about me. I have a bachelor's degree in education in music from Rabin Academy of Music in Jerusalem, Israel. I have a Master of Arts degree in art therapy that I received in Levinsky, Tel Aviv. I'm the founder and head of the private clinic Melody of Health, Ashdod, Israel. Clinical experience. Private practice in my own musical therapy clinic, Melody of Health, Ashdod, Israel. I'm working with children and adults with various developmental disabilities, autism, Down syndrome. Center Ella, working with mental pain, life crisis, traumas, losses, and bereavement. Bar-Ilan University Faculty in Music Therapy for people with disabilities. What is music therapy? Music therapy is an emotional therapy that aims to improve or alter a patient's physical and mental health and thus improve their quality of life. Therapeutic relationships are built on the experience of joint musical efforts and serve as a leverage for growth and achievement of goals in various fields. Music is a universal language. It has excited and accompanied us throughout our lives since we were in the womb. Musical characteristics such as voice, the first cry of a child, and rhythm, heartbeat, are inherent in us and constitute a natural connection of each person with music. Sometimes we don't have enough words to understand and express what we feel, and this is where musical action comes and is a channel of communication, expression, and creativity. Along with discourse and play, in music therapy, we will use techniques such as songwriting, the use of existing works and songs, free improvisation, and much more. Music therapy does not require any prior knowledge of music. Music therapy treatment goals. Helps in the free expression of emotional relationships. Solves problems and conflicts related to adaptability. Helps to reveal talkativeness, vitality, and activity. Reveals a high level of optimism, initiative, desire to be in society. Helps find a new meaning of life. Overcomes a spiritual crisis, improves pain relief, creates a fulfilling life with physical disabilities. Insomnia. Sleeping disorder, including insomnia, involves difficulty falling asleep or staying asleep. The term insomnia usually covers a range of sleeping disorders involving the quantity, quality, or time of sleep, which can lead to drowsiness in the daytime, impaired concentration, memory, anxiety, tension. Episodic insomnia, duration up to 1 week. It is most often the result of emotional stress, conflicts in the family, the state of falling in love, promotion, emergencies, personality reaction to somatic disease. Short-term insomnia, duration from 1 to 3 weeks. Most often occurs with adjustment disorders loss of a loved one, grief reaction, unemployment, moving or changing primary residence. Chronic dysomnia duration more than 3 weeks. Often not an independent disorder, but is included in the structure of other mental and somatic diseases. There's a likelihood of having a hidden disease, for example, depression, anxiety disorders, alcoholism. Some non-psychotropic drugs can cause chronic dysomnia, such as hormonal agents, antibiotics. Down syndrome. The essence of Down syndrome. Down syndrome is a common form of chromosomal pathology known to date. Down syndrome is a congenital chromosomal disease that occurs due to the appearance of an extra chromosome. In babies born with Down syndrome, the 23rd pair has an extra chromosome, resulting in the presence of 47 chromosomes. This is the main reason for the development of Down syndrome. People with the disease have characteristic facial features, low muscle tone in early childhood. Many people with Down syndrome have heart defects, an increased risk of developing leukemia, early onset Alzheimer's disease, gastrointestinal disease, and other health problems. Dysomnia and Down syndrome. Since a good quality of sleep largely determines the effectiveness of the function of memory and attention, and hence the ability to assimilate new knowledge, sleep disturbance in Down syndrome undoubtedly complicates the already existing difficulties in learning and becomes the cause of undesirable behavior. The frequency of manifestation of disturbed sleep in children with Down syndrome generally range from 31% to 54%. When we try to determine the cause of sleep problems in children with Down syndrome, we need to consider the following options. Exposure to factors that may occur in the case of sleep disturbance of any child. Exposure to concomitant disease that occur in Down syndrome and each of which can cause a sleep problem, often very serious. Side effects of medication taken. Behavioral factors affecting sleep disturbance. A child's sleep patterns can be strongly influenced by the lifestyle of the parents. The lack of certain daily routine, insufficiently clearly established boundaries, too much attention to the reluctance of the child to go to bed. This predisposition is caused by such anatomical anomalies as hyperplasia of the middle zone of the face and lower jaw, a tongue-displaced back, enlarged tonsils and adenoids, congenital narrowing of the trachea, obesity, and reduction of the muscles of the pharynx. Music therapy intervention. A cappella singing provides familiarity and safety. Holdings, music phrasing shifts provide tension release. Mantra singing enhances a feeling of stability. Ground, pause, sustained silence hold a feeling of cadential effect. Therapeutic music listening includes sleep response, tonal vocal holding in alignment with breath support. Daniel. The patient is Daniel, 28 years old, young man with Down syndrome who has trouble sleeping. Daniel is attending my musical therapy for the last 4 years, once a week. Daniel was born in Spain in 1994. During his mother's pregnancy, all tests were normal, born by cesarean section. He went to kindergarten at the age of 2.5, very socially developed. At the age of 2.5 years, problem with sleep began. At first, he was not falling asleep easily, waking up in the night, crying. At the age of 3.5, he underwent surgery to remove a polyp that was causing snoring and open mouth breathing. Since then, sleep problems have improved. Now he woke up twice a night instead of 4 times. At the age of 5, began to use music to improve sleep. Used classical music before going to bed, 5 minutes of listening during preparation for bedtime. As soon as he fell asleep, turned the music off, but used it again in the middle of the night when he would wake up. Using classical music again until he fell asleep. It took up to half an hour before he fell asleep. Every month, Daniel spent about a week in a hospital due to high fever. Listening to organ music in the hospital helped him a lot to calm down and fall asleep. From the age of 4, he began to attend the conservatory, where he studied rhythmic music, sang, and made sounds. Singing during the day helped him sleep longer at night. From the age of 6, he started music therapy sessions. The objectives of therapy: by means of music therapy to achieve a significant improvement in Daniel's sleep. During the session, Daniel and I worked passionately. I created the environment for his creativity. We listened to the music composition that drive his interest to make movements. I suggest ideas, listen to his wishes. Then beginning to slow down. At a certain stage, start playing a pipe. Daniel is found playing, repeating sounds, singing, trying to improvise. By expressing himself with his voice, Daniel finds an effective means of relieving internal tension and for self-expression. Visually, his mood changes, and with it his mental state. Verbal and non-verbal features of Daniel's behavior, expression of his character and his condition and state at the beginning of the music therapy session and throughout the session. What stimulation is used by the music therapist and how Daniel joined the setting are noted. The degree of trust and openness of Daniel in relation to the conversation. The manifestation of physiological defenses. In the process of working, I pay attention to articulation, intonation, breathing exercise. Family support is of a great importance. I stimulated and also provide physiological support to the family. You need to find a relationship inside the family that was warm and good and stimulated. We always work with families and loved ones. They try to show their support and not indifference. Music therapy helps Daniel in the free expression of emotions, solves problems with sleep. As I have already said, music therapy helps to reveal talkativeness, zest for life, vitality, and activity, and a high level of optimism, initiative, the desire to be in society. Finding a new meaning on life, overcoming a spiritual crisis, living in a full life with disabilities, music therapy helps with all of this. It happens that after the session, Daniel wakes up at night. There are nightmares, insomnia, but music therapy helps Daniel discover new strengths, new hopes. Music therapy for Daniel is a sincere, soulful, deep conversation, a real confession. His family is waiting for us to see the world through his eyes and for his condition to improve. Daniel is trying to tell us something and wants us to hear him during his music therapy session. He's in a state of deep emotional uplift. His experience stimulates creativity. It can be feelings of frustration, anxiety, fear, pain, and more. Music therapy and insomnia. Music therapy has been shown to be effective for patients with primary insomnia. Neurologically, even if the body is seemingly resting, the mind is quite active during sleep. The mind unconsciously processes thought previously dismissed or put aside as afterthought that occurred throughout the active, waked experience of the day. Slow, repetitive rhythms so often can induce feelings of safety and familiarity that can prepare and induce the brain's sleep response. Age range, level of musicality, past and present, sleep habits, and stress levels provide a new insight into what the authors called pathways of affect, which they defined as the elements involved in considering the choices people make when utilizing music as a sleep aid. This study found that younger people with higher musical engagement were significantly more likely to use music as a way to enhance sleep. How one uses music daily prior to sleep was an effective factor in music's likelihood of improving overall sleep quality when used for sleep in adults. Music therapists are concerned with not only the actual music utilized to achieve sleep, but also the decision made in creating the most clinically indicated programs for sleep. Listening to music has been selected to improve the quantity and quality of sleep due to high accessibility and cost effectiveness. Due to the lack of literature connecting music therapy with Down syndrome adults experiencing insomnia, there is a need for further research to be conducted. I'm playing for you. I'm singing and playing for you. It's time to go sleep. Say hello to you and me. Thank you for your attention.